of the Redeterminations Learning Series for all of you as assisters. Today we will be talking about when OHP benefits may end. Thank you for being here. Next slide, please. All right, so we're just going to do some quick introductions from folks on our CPOP team as well as some colleagues from other teams that are here for support. So good morning again. My name is Jacqueline McCall. I am one of the regional outreach coordinators for the Southern Valley. And then I have here with me today, Fabi.
Yes, good morning, everyone. I'm Fabiola Herrera, also one of the ROC's regional outreach coordinators, and I serve primarily the Willamette Valley region.
Thank you. And then we also have Kelsey, who will be supporting in the background with chat and questions. Kelsey, do you want to introduce yourself?
Yeah, good morning, everyone. I'm Kelsey Statham. I am the Regional Outreach Coordinator for the Southern Coast, so that's Coos and Curry.
Thank you. And then we also have other folks with us today. Next slide, please. All right, so we have some folks from the policy team as well as APD. So I'm just going to go in order. Janelle, would you like to introduce yourself, please?
Yes, I think Janelle is we're having some issues with her joining this section. So, but Janelle is here. Yeah.
All right, thank you. Christy Garland.
Hello, my name is Christy Garland, and I'm an analyst on the HSD medical program team. Sometimes we're referred to as Magi. I use she, her pronouns, and I am not on camera. I don't think anybody is, but I identify as a white female with medium length brown hair. Thank you.
Thank you. And then Christy Taylor.
Good morning, I'm Christy Taylor, also with OHA HSD Medical Programs. I'm a policy analyst with Christy Garland. Yes, two Christys on our team. I also use she, her pronouns, and I also have medium length brown hair, and I'm not on camera today. Thank you.
Wonderful. Thank you all for being here. So they will be supporting with any questions that come up and definitely know the topics very well. So thank you. All right, so just a bit of an overview of what we will be covering today here in the next few slides. So we will be going through a few scenarios when Oregon Health Plan may end, given that someone goes through redetermination. So we'll go through the overview of redeterminations just as a refresher for all of you, and then also provide some context information. Really, I think most of these topics have already been covered in previous webinars, but we'll summarize some of those main points. Then we will also go through some scenarios specifically under which OHP may end, and then a few pointers and things to remember, as well as share some resources, and then also provide the links, I believe, to the past and upcoming webinars. And then we will have some space and time for questions and answers from all of you. All right, so a little bit of housekeeping. For those of you that may be new or newer to GoToWebinar, this platform we are using today, just wanna go through some details here. So you should see a control panel as shown in the picture here. And on that orange arrow, you are able to click that, which will help you minimize and maximize it. So you could expand it and see the different options, as we see in the second middle picture here. So this will be your control panel, which you'll be able to use to view any handouts and provide any questions or comments you may have. And then also, obviously, your audio option there in the last picture, as we see, make sure to select your preferred option for audio, whether that's computer audio or through the phone. If you select the phone call option, it will appear a phone number to dial in. And if you have any trouble or sorry, any questions, make sure to type that in and we'll help you along the way. All right, so our first section here today is an overview of redeterminations. So just some background, I think we're all pretty familiar with this, but just to bring us all to the same page. So during the COVID public health emergency period, which began on March 18th, 2020, policy changes were made to approve and renew medical coverage using attested information for many of the items that would normally need to be verified. However, these policy allowances have been lifted as of April 1st of this year. So because of that, members will start receiving more requests to verify information, most commonly with new applications or renewals. Also, new applicants may be impacted starting April 1st, so already started. Current members will see these changes, which we'll go over at the time of their renewal. So we're going to show in these next two slides just some visuals to show the timeline for this process. So as we see, we started in April 2023, really April 4th, with that first unwinding renewal process beginning. Now, from April of this year up through January, renewals will occur in monthly batches by population groups. So I believe it'll be about a tenth of our OHP population per month. And then responses to the renewal notices and requests for information will be due within the 90 days. So as we see in this visual, on January 4th of next year, the final unwinding renewals will initiate. And then July of next year is when we'll really hit that final closure date for any folks that have not responded to those notices. Now, another visual, but really kind of for the same concept here. I know there's a little bit of various pictures and dates going on, but really the takeaway here is that, again, every month we are renewing 10% of our Medicaid population, so a tenth at a time per month. They will have 90 days to respond to their renewal. And if for some reason they haven't responded yet, we will give them another 60 days to respond before their benefits would close. And then after that, there would be another 90-day reconsideration period. So as you see in each row, all of that is pretty much highlighted, just with a different start date. So with this chart, hopefully it really is meant to help you understand those dates depending on when we have somebody due for their renewal. So we're currently in May. So as you can see in that first blue row there, that's where we're at. So you would just kind of follow along through that time period for that specific starting date. And then we do have the link here to this interactive tool at the bottom, as well as in your handouts tab. So if you click again that control panel, you'll see the handouts option, and it's the second one, which is the PHE unwinding timeline. So that is the full document and really interactive tool. So hopefully you find that useful and it has more information through that. Okay, now our second section is some information with context. And again, these are previous concepts and topics we've covered in other webinars. So in this first one, the context is public health emergency protections continue until the unwinding renewal period. So benefits generally will not close before a member's redetermination date. So the specific scenario here is, let's say a member reports an increase of income before they are up for their unwinding renewal date. The outcome would be that benefits will not end before a member's unwinding renewal occurs, regardless of how much income that member reports. Okay, so then the second one here, the context is now the MAGI Expanded Adult Program. So here, this new OHP program really does allow some OHP members to keep benefits when their income goes over 138%, but is at or below 200% FPL. So let's say in this case, at their time of renewal, a member's income is up to 200%. The outcome is that the member's benefit would not close. And please just note that this does not apply to Healthier Oregon members, non-MAGI members, or anyone receiving Medicare. And for more background and information on the MAGI Expanded Adult Program, we did have a webinar recently, so you could find that recording at the link here shown. Okay, and then here, let's give you a little preview of when benefits may end for various reasons. So typically, right, we have been seeing that benefits have not been ending, or had not been ending, I should say, during the COVID public health emergency. Well, that is changing now. So let's say when something in the life of an OHP member changes, they could lose benefits if they no longer meet the eligibility criteria and or do not respond to their renewal requests. So this means that benefits may end at renewal time, or benefits may end when reporting a change after renewal. So these are just some examples of how members may now start experiencing a reduction or losing benefits in this time now after public health emergency has ended. And then also know, beginning July of this year, rules are changing to allow more people to keep continuous coverage. Training on these changes will be provided on a later date. So we will have a specific webinar that touches more on that. And also, in cases where benefits may end for somebody, please know that there are other options, hopefully and ideally. So Marketplace, for example, is one. So we do have a specific webinar around that topic, which was understanding referrals to and from OHP. And we are sharing the links here to both the English and Spanish one. So please definitely listen to that so you're familiar with that process and how to help refer members that are seeking other coverage options. Okay, and then our third section is scenarios under which OHP benefits may end. Oh, I'm sorry, and I think Favi, this is when I pass it on to you.
Yes, thank you so much, Jackie, for covering that first section. Please know as a quick reminder that you can add your questions or comments here in the questions box as we go through, and then we have a great team here in the back supporting with those answers and flagging anything that we might need to save towards the end. So we kind of now in this section dive in deeper into those specific scenarios or more specific examples of when benefits might end. The first of those we wanted to kind of go over on for the income losing benefits, and this one is specific for when someone is on MAGI, on the MAGI program, so or has MAGI coverage. I do want to kind of give a quick reminder to folks on this section about MAGI and non-MAGI programs and what does that stand for. So just a quick reminder, our MAGI stands for Modified Adjusted Gross Income. Some of you or all of you are quite familiar with that, but just kind of, again, as a quick reminder for all of us, our MAGI programs are for individuals or for people who are under age 65 and are not disabled. And also kind of a quick reminder on MAGI income rules. Those are based on monthly or yearly income. And specific MAGI programs do not count resources. On the other end, our non-MAGI programs are for folks or for like individuals who are 65 years plus or an older and or disabled. Our non-MAGI income rules are based on monthly income, and it does count some resources. So for example, savings, they also might have some lower income limits than MAGI programs and might also require an interview after an application is submitted. So now that we have that kind of additional context on MAGI benefits or MAGI coverage, let's look at this first column. And for some scenarios when benefits might close, OHP benefits might close with an income about 138% of the federal poverty level, which is our FPL. And this is, the first one is for adults that have benefits under the Healthier Oregon program. Again, we gave you the quick context on the MAGI Expanded Adult Program. But in this case, we know that our Healthier Oregon members might not fall under that program. So in that case, they could close benefits above 138%. Another scenario is for children with other major medical coverage. We also know it as TPL, third-party liability. Basically, they have other maybe private insurance, and if their income or the income of the household is about 138%, their benefits, OHP benefits might also end during the renewal. Another scenario is for individuals on Cowen Plus, which is our citizenship wave medical, and the Cowen Plus is our pregnancy benefits. If they pass their 60-day protected period already, again, during the renewal, those benefits might also end if they're above this FPL level. Another kind of in this second column here, for benefits that are closing above the 200% of the FPL, we have our MAGI adults or adults under the MAGI program with OHP Plus that are not in the Healthier Oregon program. Kind of in the same row here, the Healthier Oregon program members might close at a different income level. And on our third and last column, for those that have benefits or OHP benefits might end about the 305% of the FPL, we have children without other major health coverage or other like TPL or private insurance, for example. All right. Now, let's look at some of the common reasons for losing non-MAGI coverage. So again, this is sort of those common scenarios that we might see, specific again for our non-MAGI programs. One of those is certainly being over income. Might be one reason for ending the OHP benefits. Also for being over resources. We're not going to dive deeper into the income and the resources on this section, but just know that those are some common reasons why benefits might be ending. Another one is failure to provide requested information. And lastly, the failure to complete the renewal process. We know that folks have to go through the renewal, and that includes, for example, interviews. As we mentioned before, they might require to complete that interview, and if they don't complete it, for example, those benefits could also end. All right, and then we do have some specific examples on ending of benefits regarding to income. So again, these following scenarios show those specific examples of benefits ending for members at the renewal time. So the first one of those, we have maybe like a 24-year-old member that has income above the 200% of the FPL. Another scenario will be maybe a 62-year-old Healthier Oregon member that has income of 150% of the FPL. One of the a third scenario will be, maybe a child that has TPL. Again, TPL is like the private insurance or other major coverage that has income of 185% of the FPL. And a last a scenario or example is just a Cowen Plus 34-year-old member that gave birth maybe 12 months ago and also has an income of 150% of the FPL. I do want to point out that most people will have reported higher income prior to the renewal time. Therefore, maybe during the renewal time, their benefits will end with a higher income, maybe during a passive renewal. We do know that sometimes their income is within eligibility in our system, and then it will go through that passive renewal and is maybe either approved or approved with a soft pen. When and if only if they reply to that RFI, to that request for information, or maybe review their case summary and realize maybe that their information that we have is wrong and they let us know of this information, then in that case their benefits could end or be terminated due to being over income. All right. So now we're actually going to dive deeper into specific age-related scenarios. So one instance or one case when, again, benefits could end is for folks that are turning 65 years old. We do have a specific scenario here for a member that turns 65 and does not meet the eligibility requirements to continue OHP through the non-MAGI OSIPIN program. So remember those requirements or who qualifies for those non-MAGI benefits. So the OSIPIN program, just here at the footnote we added is, as a quick reminder, the Oregon Supplemental Income Program Medical. It's OHP plus benefits for folks that are 65 and older, they're blind or disabled. So again, if a member turned 65 during the pandemic, they might be subject to different income and resource limits in order for them to keep their benefits at the time of the renewal. So we do know that OSIPIN program has different eligibility criteria than the MAGI OHP program. So if over income or resources for OSIPIN, which is a full OHP for 65 plus, are disabled, they might lose then their benefits. We always really encourage and recommend folks enrolling in Medicare. We do have a quick link here for some resources, some basic information about the Medicare. But again, the recommendation is always for those that are turning 65 to look into Medicare and enroll if they qualify. All right, so we also wanted to kind of give a brief example of those that are turning 65 years old, but maybe that they are keeping their benefits. We know this is not necessarily that folks, the scenarios that we've been looking at, which is when their benefits might end, but we also wanted to make an important note in here. We do have a scenario of a member that turns 65 during the public health emergency and maybe does meet criteria for full OHP under the OSIPIN program. In this case, members who turn 65 again during the PHE and meet the income and resource limits for OSIPIN, they might be able to keep their OHP benefits. So we really encourage members to also apply for Medicare, as I mentioned in the previous slide. members can have Medicare and OHP. So this is not new information for many or most of you. So these members are actually known as full dual eligibles. So you might not have seen that full before dual eligibles, but we do know that they're the ones that qualify for, again, Medicare and OHP. We did wanted to add a quick note in here that Healthier Oregon members are subject to the same eligibility as other members. The only piece of eligibility that they don't have to meet is the citizenship or non-citizenship criteria. So quick note on there. All right, so now let's look at an example of OHP closure notice. So we have the renewal notice guides. Actually, that's a really great resource. We really want to recommend that if you haven't had a chance to look at this resource, to go in there. And I actually think that we have a moment for us to kind of look briefly of the website where you can find these notice guides. We know that there have been a lot of questions regarding notices that members are receiving during the renewal. So I think that we can take a moment to just guide you through that webpage. But here's also the link where you can find those notices. These notice guides are available in English and in Spanish, but this is just kind of a quick look of how it would look like actually for a member when they receive a closure notice. So as you can see, so this is the first page of the notice. Each notice, I do want to point out, has a call to action box that shows the purpose of the notice. So in this case, we see here, like maybe medical benefits are changing in this case or have changed. The text in the box will really vary based on the person's situation and what the state needs, maybe what we're needing to, what information we need. The color around the box will also vary here. But again, if it is a closure notice, we'll likely find this color here. But if it is a green, maybe there is maybe a person might have renewed their benefits or some benefits are opening. So I just, again, want to point out that this is benefits changing here, kind of gives you that preview of what you'll be able to find or the member might be able to find within the notice. And then this is, as folks go through the notice, they'll be able to see or get to the section of the closed benefits. People can really quickly scan the table in this section to see which benefits are closing for which person in the household, why is closing and when is closing. So the reason and the benefit end date. The table actually also refers back to a specific Oregon administrative rules that apply to that eligibility decision. So this is kind of a quick look of how that closed benefit section will look. And I have mentioned briefly that we could take a brief look here at how the notices look. And if I have a moment here, give me 1 second as I get to those notices. Okay. So some of you might already be quite familiar with this web page, but this is a web page that we've been referencing to in a variety of our webinars, and it's our end of the public health emergency. And this is a specific, and I'm a partner. This is a really great resource, and we again recommend you to look at these specific notice guides. You'll be able to find them here in the partner resource, and this is actually what you'll be able to see. The notice guides again are in English and Spanish. It's a variety of them, and they have really great information, and it walks you through what to look for or how to read those notices that members are receiving. So again, a really great resource both in English and in Spanish. So I'm gonna take this part away now. And okay, so now that we looked at the closure notice examples, let's go to the next one. We so this other section, we also want to talk about some other scenarios that are not specific to redeterminations, but are also pretty important to remember. Pretty common scenarios. Some of these, again, you might be quite familiar with. So let's dive into the first one. We know that when a member moves out of Oregon, OHP is only available to folks or to people living in and planning to stay in Oregon. So members must report moving out of a state. So here to report a permanent move out of a state, just be sure to update the answer to the Oregon residency question in 1. Changing an address in 1 doesn't trigger the closure of medical benefits by itself. And I know that this has been a question we've been receiving from community partners across the state. So just know where the change should be made in the 1 system, or where the report must be made for moving out of a state. Another scenario, or just another note here, is OHP might close benefits if it's confirmed that a person has moved out of Oregon and has started receiving benefits in another state. All right. Even outside of the redetermination period, this is just a reminder that moving out of a state is a reason that benefits will end. All right, so now, again, a member becomes incarcerated is another scenario when benefits end. We know that OHP is not available at this time to individuals who are incarcerated. So basically, when a member is incarcerated, their OHP benefits are suspended. In the 1 system, we will see those benefits as closed. However, benefits can be restored without a full new application within a year of release. So up to 12 months for our justice involved community to be able to restore those benefits. All assisters can help individuals that are being released from incarceration. So that's a really big and important note. However, we also want to point out that we have some folks or some of our community partners that work with the justice involved system and call them justice involved assisters, have those extra pathways. So if you're interested on becoming a JI assister, we really encourage you to connect with your ROC to find out how you can become, again, a justice involved assister and have those extra pathways available to you so you can help our community, our justice involved community. All right. We are getting close sort of to the end of the content, but we do want to point out some things to remember. Please, first of all, is remind members to always report changes and keep their case information up to date. This has been messaging that we've been sharing with everyone, and also remind members to read notices carefully. Some members will receive more than 1 notice during the renewal. We know that they might receive like maybe 2 notices. So please remind them to read those notices carefully. In fact, we know that our community is getting a lot of mail, so encourage and remind folks to open their mail. I know that it's very easily something that can be missed, but really encourage folks to read their notices, to open their mail. And also a quick reminder on folks that are losing their OHP, they will have 60 days before OHP benefits close to enroll in private plans and avoid those gaps in coverage. So in this section, we really want to kind of refer you back to the transitions to and from OHP webinar that was presented and those recordings that are linked on the previous slides. All right. So we also wanted to give you some resources. These listed here, by not all means all inclusive. There is probably a lot of other resources that we didn't include here, but we wanted to make sure to give this information to you as well. So we know that we have our aging and people with disabilities as a resource. We have our case managers, our APD offices. We have Aging and Disability Resource Connection, the ADRC, and we have the link here as well. We have community partnership coordinators at our local ODHS offices. They're really support to members that are looking for resources as well. We have our FQHCs, which is our federally qualified health centers. And here's the link of where you can find an FQHC in the state. They're another great resource for accessing care. We have another resource, the Volunteers in Medicine. We also have some free clinics throughout the state. It varies by region, so we don't have a specific link, but know that that is a resource as well. And our Shiva Senior Health Insurance Benefit Assistance, they're an amazing resource. Here's the phone number and direct link where you can find the information. As a quick reminder, our Shiva is for individuals who have Medicare and are losing OHP Plus. They can really be a support and a help with signing up for other coverage options for people again on Medicare. All right, so we do kind of want to remind everyone about upcoming CPOP learning opportunities. As you heard previously, there are some changes that are coming, and we really want to keep you up to date. We have now new dates for a common redetermination learning series. So you'll have this information with you. So if you're registered, you'll continue to receive those reminders. But we want you to know, like we're gonna take a short break in June. In June, we only have the Spanish version of this webinar, of today's webinar. But in July, we'll kind of go through a summary or recap of the PHE unwinding, more opportunities for questions at that time. We do intend to have another specific webinar on continuous eligibility in July, and with more information about all the changes that are coming up with continuous eligibility. And then also we hope to have some Healthcare Oregon program updates in August. And the same goes here in our Spanish modules. The PHE Unwinding Partner, Community Partner webinars and the provider webinars have ended. We don't have any other dates of those, but those have been another great resource for our community partners. So we're just including the link where you can find the Spanish and English past webinar recordings. Again, those continue to be great resources if you're interested or have an opportunity to check the previous webinars. Again, thank you everyone for joining us today and for sharing your feedback, your comments, and yeah, just we'll hope to see you soon on the upcoming webinars. And again, thank you so much for your time. And thank you to our policy team for being here in the background, providing us a lot of support today.